Welcome to the FUMS Now podcast show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at FUMSnow.com. I'm your host, Kathy Reagan Young. Hello and welcome back to the FUMS podcast show, everybody. There's so many podcasts out there now. I really appreciate you choosing this one to spend your time on. I'd like to humbly ask you for a favor. Would you please share the FUMS podcast show with 3 people that you know could benefit from it? If you find this show valuable, you can think of it as giving a gift to others, and it would certainly be a gift to me. So thanks in advance. Today's guest is Dr. Meghan Beier, a psychologist at Johns Hopkins University School of Medicine who specializes in multiple sclerosis. Dr. Beier completed her PhD in clinical psychology, health emphasis, from Yeshiva University, and following that received a postdoctoral fellowship at the University of Washington, where she focused on rehabilitation, cognition, and mental health in individuals living with MS. Dr. Beier's passion for improving care for people living with challenging medical conditions led her to create FindEmpathy.com, which provides continuing education for mental health professionals focused on how best to serve patients who live with MS or other life-altering illnesses. I'm excited to welcome her. This is such a needed service. Welcome, Dr. Beier.
Thank you so much for having me. I was really excited to learn that I would be talking with you. I've actually shared your podcast and website with many of my patients. It's such a great resource.
Oh, thank you. I appreciate that. And I'm so grateful that you took the time to talk to me about this. This is a phenomenal service that you're providing, and I'm excited to learn more about it. So let's start with what brought you, not only to this type of work, but mental health issues specific to MS patients. Do you have a connection to MS?
Yeah, I've been asked that multiple times. I don't actually have a personal connection in the sense that, I don't have a family member or a friend who's been diagnosed with MS. I kind of fell into it by accident. Mm-hmm. When I was pre-grad school, I was always interested in psychology, and my family is filled with physicians, and I knew I didn't want to go to medical school. So I thought, psychology. And I ended up, before I went to grad school, working at a place called Bancroft Neurohealth with individuals who have traumatic brain injury, and they live in assisted apartments there. And so my role was to be a direct care worker. So I would drive people to medical appointments. I would make sure they took their medications. I would spend time with them. And I really fell in love with working with individuals who had neurologic conditions. So I thought I would go to grad school and I would work with brain injury, and maybe I would do research, or maybe I would do clinical work. And so I started looking for programs that had sort of that emphasis. And what I found was that there was programs that had health psychology, which is sort of the medical side of psychology. And my second year or so, I met somebody named Fred Foley, who was my dissertation chair. You might recognize him. He's well known in the MS world.
And he's been on the FUMS podcast show, I might
yeah. He's great.
He is
wonderful.
great.
I have such a good relationship with him. And he was looking for a grad student to help out in his clinic. So I was lucky enough to be picked for that position. Excellent. And I really just fell in love with working in MS, similar to how I fell in love with working with traumatic brain injury through my work in Bancroft. But the difference was, I think in brain injury, there was a lot more research and evidence and clinical programs that were available. And it felt like there was this huge gap in the MS world. And so I felt like there was a role for me to play there.
Excellent. And I would agree, by the way, huge gap.
Still, yeah.
Yeah. On your website, I found this mission statement, quote, "Find Empathy's purpose is to help people with medical conditions find the mental health providers that understand them best, and to connect mental health providers specializing in health psychology with the patients they want to help," unquote. So this is really a two-way street. In other words, you help both the providers and the patients. Is that right?
Yeah, absolutely. So what I kept hearing in my clinical work, and actually I do some speaking for Can Do MS, which is a great organization.
Great organization.
I love working with them. I kept hearing from people, I'm looking for a psychologist, or where do I find somebody like you near me? And I would look on the National MS Society's website, and they're a great resource. I reached out to the MS Society, and they said, well, our list isn't even that long. We have people and providers, but we could always use more. And then I have a few friends who went through a similar health psychology program as me, and they were in private practice. And they said, people just don't know we exist. We keep getting referrals that are general psychology, which is great, but we are really trained to work with people with medical conditions, and they just don't know we're out there. So I kept hearing kind of from both sides of the spectrum that there was a need to find each other.
Yeah.
And I thought, maybe there's some way that we can create this list so that people know where to find the providers, and providers can find the patients that they're best trained for.
So you're the Match.com of health psychology.
Exactly. Well, I hope so.
Yeah, that's great. Well, health psychology, it's a new term to me, but I think you just answered that question. It is training specific to folks with medical conditions. Is that correct?
Yeah. So I think a lot of times I actually heard a patient recently say, well, all mental health providers are the same, right? I was referred to you and I would work with you because everybody's the same. And that's not true. In the American Psychological Association has 54 different specializations. So just like you wouldn't go to an oncologist to get your foot pain treated,
right?
There are different kinds of psychologists and social workers and licensed clinical therapists who really specialize in different areas. So in my realm, there's kind of three zones. There's health psychology, which is really focused on medical conditions. So that might be something like MS or diabetes. There's rehabilitation psychology, which is working with people that have disabilities, which could also fall on the spectrum of
overlap.
MS.
Sure.
Right. And there's neuropsychology, which is that cognitive side of things. So, MS could fall under any of those umbrellas. So it is challenging to come up with the right terminology, but essentially all of those are psychologists who are trained to work with people that have specific medical diagnoses.
That's amazing. I've been doing this kind of advocacy work since 2011, I think, is when I started the website, but I was diagnosed in 2008. So I've been in it for a long time, in other words. And this is the first time I've heard this, unfortunately.
Yeah.
And I've worked with mental health therapists in the past, and I always have to bring them up to speed on MS and what it is and what it can potentially mean and the unpredictability of it. I can't imagine how much further along we would be if they knew that all when I met with them the first time, because I have felt like I'm providing the education to begin with and kind of the filter there forward.
Yes.
For a more perhaps general psychologist or psychiatrist, because it is very different. I mean, every condition is going to be different and it's going to present different issues, right? So this just makes so much sense. But honestly, I never really considered it. But gosh, you'd be way ahead of the game if you could find somebody who actually understood this right out of the gate. It's really going to be a gift, what you're doing for people with MS. But it's not just, we're talking about MS because this is the FUMS podcast show, but it's for other, you sort of have other conditions under your umbrella as well, right?
Yeah. So my first podcast series, which is, I only have one episode out. So hopefully one day I will have as many as you, but that's going to be focused on MS because that's my specialty. But the need is there for almost any condition that you can think about.
Yeah.
I see relief in people's eyes when I meet with them for the first time, and they don't have to describe to me what PML is and why that's a scary thing, right?
Yes.
When I can talk to somebody about fatigue and that them not getting out of bed in the morning because they're fatigued is different than depression. That's a huge
different
relief.
From being lazy or
exactly
unmotivated. Yeah.
And there's so many other factors that come up that are really specific to different diagnoses.
Yeah.
I even just talked to somebody recently about apathy in MS and how that's more of a cognitive perspective than something like a mood disorder. So if you went to see a general psychologist, they are very well trained on general mood disorders. But if you had apathy due to cognitive challenges, meaning that you just can't initiate an action, then they might not get that. They might think that this is somebody being resistant or that it's more depression. So I do think that there's a huge benefit to meeting with somebody that you don't have to educate and that can really jump off. And I also think that there's times when, because our MS providers, one of our MS providers, Dr. Newsome, also works in something called stiff person syndrome, a very rare condition. He refers some of those individuals to us as well. And so I've gotten to work with a few individuals. And one person told me, I've been through 3 psychologists in the community, and every single one said, I don't know how to help you. So it's not only educating people where you're spending your own time and money educating a psychologist or a master's level therapist about your condition. You're also maybe going through multiple therapists who also are kind of fearful and don't know how to help. And, there's just a lot of money and time that's being spent on that.
Yeah. The doors to the Patients Getting Paid membership community are now wide open. This is a community of people with chronic illness learning to find and create flexible, remote work that accommodates their health. I call us chronicpreneurs. There are trainings, coaching calls, networking opportunities, co-workings, and a ton of resources. Want to take better care of yourself and still generate an income? Join us at patientsgettingpaid.com. You bring up a really important point, though, that I just really want to emphasize, and that is when you are working. I would personally say this is across the board, any kind of professional, health professional. If it's not a fit, don't give up, right? Try again, because the fit's going to be out there for you and you can get some help, and it's so important to get help. But it's super disheartening to think you found somebody, I think particularly in mental health, and then it not being a fit. But I want to just kind of emphasize that stick with it, because it can make such a difference and mental makes a difference in physical. That's been emphasized in my life over and over and over again. Mental health makes such a difference in physical health. So I just want to kind of emphasize that whole thing.
And to piggyback on that, if I can,
please.
I say that to all of my patients too. I think it's the match is such a huge piece of it. Every first session, I tell people, if you don't feel like you're jiving with me, if you don't feel like we're the right fit after the second or third visit, please talk to me about that, because I've now gotten to know you a little bit. And so I might have an idea of somebody in my circle who's a good fit. And I think most mental health providers would be open to saying, if you said to them, look, I don't think that you're the best fit for me, but do you have any ideas of who in your circle might be a good fit? I'm more than happy to do that for people. And so I hope that others would as well, because the research shows that if you feel connected to somebody, you're more likely to have positive outcomes. So you want to have that good fit from the beginning.
Yeah, love that.
Hello there, friends. It's Matthew Zachary, and I'm really excited to tell you about a fascinating new podcast called Healthy Conversations, hosted by my friend and colleague, Dr. Daniel Kraft, and presented by CVS Health. Every other week, Daniel drives one-on-one interviews with the people who are transforming healthcare in real time: physicians, scientists, technologists, and industry leaders. Let's go beyond COVID-19 to a place where telemedicine and mRNA are nothing more than table stakes. Let's hear about tomorrow's precision oncology treatments, the latest in guided genetic health, and the evolution of value-based care. Maybe the breakthrough research that is redefining functional medicine. You'll hear from the people who are innovating tomorrow's clinical insights today. It's been said that the future is already here. It just hasn't been democratized yet. Healthy Conversations with Dr. Daniel Kraft from CVS Health does just that. It's available for free wherever you get your podcasts. New episodes appear every other week. Subscribe, listen, and learn today.
So tell me how this works. Do you seek out mental health professionals and then, offer education in individual diseases to better equip them to deal with individuals dealing with that disease, like MS in this case, or they come to you already, I guess, accredited in those diseases, right?
Yeah, so we're still very new, but I'll talk to you kind of about my vision and sort of how it's worked so far, which is kind of both directions. So right now on the website, we have about 30 people, not a lot, but we're building regularly all the time. And all of those individuals were pre-trained in one of those realms that I talked about earlier, health psychology, rehabilitation psychology, neuropsychology, or have experience in working with people that have particular diagnoses. So I think that there's a lane for people who have already been trained in this area, but want to know more about a particular diagnosis. Just the other day, a friend of mine reached out and said, I work with rare conditions. I have a new person that walked in my door. She's a health psychologist. She's very well trained in health psychology, but she's never worked with this particular diagnosis. And she said, do you have any physicians that I can talk to so that I know what what I should be focusing on with this individual? So that's kind of my goal is if you are already trained, but you want more about a particular diagnosis, we can provide that. The other side is there's a lot of mental health providers out there who are more generalist, who you described meeting with somebody and having to educate them. Well, if they are more of a generalist and they want to learn more about something that you're living with, well, maybe they can pick up our podcast or go to our website and get more about that particular diagnosis so that they can best help you specifically, or the patient that's sitting in front of them.
Oh, that's great. And you offer CEs or continuing education, right? So what is that education based on? Each individual disease state?
Right now, we're accredited by the American Psychological Association to provide CE credits. We're responsible for all of the content, but they have given us the stamp of approval that, that you can provide that content. I based this first series off of the Consortium of MS Centers has an MS specialist diagnosis. What's the word I'm looking for?
Designation?
Designation. There you go. And they have kind of an outline of what they think that means. What do you need to know about MS? So I kind of took that outline and I created a podcast series on each of those topic areas.
Oh, great. Okay. And are patients a part of this specialized training at all? Because I've often thought that patients should be part of med school to get the real world take on what it's like to have the disease and how the medical professional could, help patients more by understanding their struggle, right? Their day-to-day stuff.
100%. I truly agree with you. I don't think that we can really teach something without hearing what it's like to actually live with that diagnosis. You can sit there and read it in a book all day, and you're not actually hearing it from the person who's living with it. So each episode has, at least for the podcast, starts with an interview with somebody living with that diagnosis. And even more specifically, so for example, what it was like to get diagnosed with MS or something like that. And then we go into talking with a researcher who researches that topic and a clinician who's actually working with somebody on that topic. So you kind of get the full gamut of what's it like to live with it, what is research saying about it, and then how are clinicians using that information to best help the people that they're working with.
Wow, that's great. What are the professional designations that you work with?
Yeah, so right now we're only approved to provide CEs for psychologists, but I see this as something that could be useful for any mental health provider. So we're actively completing the applications for social workers and licensed clinical therapists. So soon, hopefully in the next couple of months, we'll be able to provide continuing education for any mental health provider. And so, I've geared this towards mental health because that's kind of my goal and my vision. I actually had a friend reach out to me who's a nurse and said, I actually think this would be helpful for nurses. So, if anybody wants to listen to it, if somebody who's living with the condition wants to listen to it, a family member, anybody in their medical team wants to listen to it, I welcome it. It's free, it's available. But, only if you need the continuing education credits, is that what we're working towards? But really my goal is to kind of gear this towards mental health providers, but it's available for anyone who finds value in it.
That's great. And expanding, ever expanding, right? And patients can go to your website, which is findempathy.com. All of this is going to be in the show notes. So, and they can search for providers based on their conditions.
Yes.
I did that for MS, and you are the closest practitioner to me, by the way. Do most of the practitioners offer telehealth services?
Absolutely. Yeah, especially post-COVID. There were many who were doing that pre-COVID, but now for sure post-COVID. There's something in the psychology world called PsyPact. So if people haven't found that yet, you can do that. But it's called PSYPACT, PsyPact. This is a designation that any psychologist can apply for. And right now, about half the states in the United States have signed on to it. And that means that you can work with any provider in any one of those states. So I'm a PsyPact member. I could work with people who are in Georgia or in Colorado or, in Maine.
Right.
So yes, there's lots of people who are working via telemedicine. Mm-hmm.
I just hesitate to say that there's anything good that's come out of COVID, but that sure is one of them. I tell you what, this telehealth and now what you just described of being able to go, across state lines and whatnot, it's makes all the sense in the world. And it took COVID to force the issue. But so I'm grateful to COVID for that. So thank you so much for being here and sharing this wonderful resource. Please tell everybody where they can go to learn more about Find Empathy and your podcast too.
Yeah, absolutely. So the website is Find Empathy if you're a patient and you're looking for a provider. If you are a provider or want to find out more about the education side, findempathy.com/learn. For the podcast, we are on any platform. Well, we're on right now Amazon, Apple, Google, and Spotify. But you can also listen to all of the episodes on the website. So if you just go to findempathy.com/learn, you can also Google my name or Find Empathy. And we are on LinkedIn, Twitter, Facebook, and Instagram.
Excellent. And again, I'm going to have all of those hot linked on the show notes. So just go to FUMSnow.com/podcasts and you'll find it. So thank you so much, first and foremost, for doing this. I'll say it for the community. We appreciate anyone who is stepping up and helping us. And boy, this does seem like there's a gaping hole there. So we really appreciate you recognizing it and working to fill it for us. I think this can make such a huge difference. I'm really excited about this. So, and thank you for being here today. I appreciate that as well.
Well, thank you so much for having me. And I truly hope it's a resource that grows over time. So, yeah.
Excellent. Great. Thanks again. Take care.
Thank you. You too.
Quick shout out to Steve Woodward at podcastingeditor.com for the fantastic work on this podcast, including editing, show notes, and ingenious ideas. If you'd like help with your podcast, whether you're just starting out or an old pro, visit podcastingeditor.com and tell Steve I sent you. Thanks, everybody. I really appreciate you listening to the FUMS podcast show. Be sure to subscribe to it so you won't miss an episode. You can do that right on the website at FUMSnow.com. While you're there, sign up for the free email list so you'll be among the first to know of any new findings in MS research, new therapies and products, as well as any blog posts and podcast episodes I release. Want to chat with others in the FUMS community? Join us on Facebook at FUMS Now. Thanks again, and don't forget to talk to the stupid disease as it deserves. Tell it FUMS every day.